All right, I want to talk about a particular kind of low back pain. If y'all don't know me, my day job is that I'm a physical therapist assistant. Most of the stuff that I do is neurological, and most of the stuff I do is with older folks, so like stroke recovery, Parkinson's, um, balance, after somebody's been sick for a super duper long time, just getting them standing up again. But this is one of my orthopedic wheelhouses. So, everybody's going to have low back pain at some point in their life. Most of it resolves. We can talk about the anatomy and how slip disc this or arthritis that, facet mediated disc that. Okay, cool. There's a million things to it, but there's a particular kind. If we ask you to show me where it hurts, and you trace that line, if your instinct is to trace the line of your sacroiliac joint, that's probably where it actually does hurt. And it's really hard to train muscles to support that. And it's not a situation where like it's muscular tension that we can relax. It's probably actually is the joint of the two parts of your pelvis, the sacrum and the ilium, that are supposed to be kind of fused but kind of mobile. They should move a little bit, but they shouldn't move too much, and they get inflamed. Ladies particularly, because that joint softens up about a week before the menstrual period. Um, if if you find yourself going, oh man, that, and like your bridges don't help, your stretches don't help, whatever has helped in the past isn't really getting to it. This is a sacroiliac belt. It's about $30. You can get them on Amazon, and you wear it. It's not a back brace. It's not doing the work that your muscles should be doing. This is approximating the bones in your pelvis. And you wear it and you tighten it up. And if it feels good, it's probably doing the right thing. You would wear this like most of the time. You can wear it when you're sleeping. Wear it for about a week or two, and your symptoms will probably improve, and then you can quit. That's a thing that I have discovered now. A reason that your sacroiliac joint might be inflamed, it could be hypermobile, it could be any number of things. There are specialists who get into that. A fix. Let's move the camera to here. How about that? If you can get on your back, get a stick, and you try to break the stick, and then try to break the stick real hard for about 3 or 4 seconds. That often provides a lot of relief. Doesn't address the cause. The cause could just be skeletal. Could just be the way that you're built. It could just be a temporary inflammation. Could also be tight hip flexors. Iliopsoas is a common culprit. Iliopsoas is hard to work with. I got this little guy, and if you search for, I think it's like a psoas release tool or something on Amazon. These are like $30, and you can place that. The anatomy is that it's like right here in your hip. So if the pain is here, the muscle that we're trying to release is here. And you can just like lay on it right there. And it sucks. To get a muscle to release, You need to actually relax. You need to apply consistent pressure to the trigger point for about 45 seconds in a relaxed state. When you're doing this, it's hard to get the right amount of pressure to actually relax. But it helps if the dog comes and kisses you. So you'll kind of fight the tension of the fact that it hurts and that it's deep in your gut and the attempt to relax. So it'll take like a minute and a half before you get any kind of results, but you can kind of feel it like, yeah, you can feel it let go when it lets go. Okay, so that's it, that's to release that muscle, and that's iliopsoas. But here lately, I think I've found that you can release iliopsoas, and its job is to simply flex the hip. But I think more often the culprit is like rectus femoris, which goes from here and crosses the knee. And that's people will say stretch your quads, and we do. And this is a good quad stretch for a lot of people because it's stretching knee joint. But we need to stretch the knee and the hip at the same time, which might actually look more like this. Let's see. Put your band on like a belt and then step through. Down on the belly. Here, my knees are stretched, and now my hip is stretched. The science of stretching to lengthen a muscle is you need to hold it for a minimum of 30 seconds at about 70 to 80% of what you're willing to put up with. This stretch is not fun, and to be real effective, you kind of have to get that pelvis down. You have to feel your pubic mound touch the floor. If you press into the stretchy band, you're using the muscle that you're trying to stretch, and sometimes that'll let you get a little more relaxation into the stretch right afterward. So anyway, for particular low back pain, those are some things that you can look into, and that I have I've been having some fun with for the past couple weeks.